Thanks.
That's great. Thank you, Kuminen. I think it gives a different perspective, a global perspective on what's happening, and I think it's tremendously important. So we heard a lot about herd immunity, and we're hearing more and more about herd immunity. I think you brought it up as well, that if we don't get a vaccine in the next 12 to 18 months, how does herd immunity protect you, and how does this physical distancing affect herd immunity going forward?
You want me to start with that, or?
Sure, jump right in.
So, I mean, with an R naught of 2 is 1 minus 1 over R naught of the herd immunity, so it's about 50%. So we need to get 50% of the population infected to help prevent effective spread from individual to individual. The big question right now, and I think the most important information that's going to be available to us in the next 2 to 4 weeks, is countries are doing serological surveys. They're testing individuals for antibodies to see how many of us actually have gotten this. Blood systems around the world are doing it. Canadian Blood Services are doing it. We know that I think some of the Chinese studies saying 80% of us may have asymptomatic infection. So, and that's really going to tell us where we're at. So I think the German study, the first study that published, said about 15%. We probably won't be that high in Canada because we haven't had an outbreak like that. But are we 5 to 10%? It's going to make a big difference, like 1, 5, 10, 15, 20, about how close we are to that 50%. And as we get close to that 50%, we can reduce the other measures because the effective R naught drops. So it gives us more freedom. But ultimately, we need a vaccine. And this is the previous vaccine for similar conditions have caused what they call disease enhancement syndrome, where you actually got the disease worse. They think they figured out why that is, and so they're working on a vaccine that can avoid that, but it means that they really have to test it. So that's why the 12 to 18 months time horizon is given for the vaccine.
And Kumar, just to follow, like the movie Contagion, people wore bracelets that kind of showed their immunity. What do you see happening in the next year? How do people prove immunity? Yeah. How do you see people starting to come out of their homes?
So this is an interesting question, and it's being discussed in several countries right now, and we've actually suggested it to at least explore it at the governmental level. So if, let's just say optimistically, 15% of us have been exposed and have natural immunity, we can detect that with an antibody test for IgG, and then theoretically we are immune, and we can then go back into society and leave social isolation. This is going to be particularly important for our frontline workers, because knowing that you have immunity is going to really help determine, who can provide that care. There are a lot of problems with this. First of all, we don't know if, what the risk of reinfection is if you have humoral immunity. We don't know how long it lasts for. We don't know the titer that confers that immunity. These aren't questions we're going to be able to answer quickly either. There are also huge ethical questions, because let's say you're a really good citizen and you are socially isolated and you didn't talk to anybody and you never developed the infection, suddenly you're penalized. Or do I now want to go get exposed so I can get this protection, this immunity passport? So there's a lot of issues to work through, but we're not in perfect times and there are no perfect answers right now. And we need to get the economy going. We need to get people out. And it's not ethical to keep, a battered spouse living with their spouse if you know that they had immunity. Like if they were immune and they could actually leave, and we know this is becoming, WHO has talked about the problem with domestic violence and the lockdown. So the ethics go both ways. The idea is to digitize this and to allow people to easily show that they have the immunity, and it's going to be important for international travel. I think it's going to be a requirement for international travel, proof of immunity either through serological or a vaccine. Like we have the yellow fever. And just to use another analogy, in the 1800s, that smallpox scar you got from your vaccine, that was your proof of immunity, and it's how people identified you as immune. We need probably a digital version of that as we move forward.
Anybody else have any comments on that and sort of the ethics of doing that, letting people out if they're immune, measuring immunity?
It's not something I'm really keen to wade into. I think it's a really big challenge to deal with. And I was just going to say, Gil, you don't have your immunity bracelet yet, obviously. So I'm just kidding. I don't have one either. So, yeah.
And I should say that one of the major factors that we have to be concerned about is vulnerable patients, right? Vulnerable people. So the elderly, people like you who have IBD, who are immunosuppressed and immunocompromised. I think part of the idea of herd immunity is that the healthy people may eventually very slowly become immune, allowing the more vulnerable populations to finally get out. But what that means in terms of the length of time that you might be isolated if you're older, or if you're on immunosuppression medication, we're not really sure. Nobody's really addressed that yet.
Yeah, and I'll add maybe, sorry, Doug, I didn't mean to cut you off. Just there, Kumanen mentioned that, the whole issue of the tension between the public health measures and the economy, but, and I know that you know this, there's other measures that are being considered in all of this, right? And you just alluded to one, Eric, how this is influencing vulnerable populations, and is it influencing them disproportionately that we need to, and how would relaxing physical distancing influence them? And then, of course, the mental health of the populace as we, I mean, I can't imagine, how much more difficult it would be, or it is for some people. I have I'm very fortunate, very privileged to have the circumstance that I have, and, not everybody's fortunate enough to have that. So.
And the one comment I would add is that even though it may seem attractive to get it over with, this really isn't the time to do that. All of these projections and models that have been shown by Tyler and Doug, they all are still based on the fact that society is doing the physical distancing to give us time to prepare our healthcare system. Not to mention, in 6 months from now, we may have an antiviral agent or another drug that turns this from a severe disease that you end up in an ICU to something that analogous to a common cold. And so again, you want to get sick and eventually get this immunity, months down the road. And just to give you an example of what time has bought in terms of the healthcare system, I can give you some examples of what's happened in Calgary in the last 4 to 6 weeks and what we've done to try to address our healthcare system and the projections that we were seeing by Tyler and his group. The key thing for us was a month ago, a few weeks ago, we did not have the capacity to deal with the influx of COVID that was being projected. So to give you a sense, Alberta has about 8,500 hospital beds, and we projected that we needed to add over 2,000 new beds. And how do you add 2,000 beds in weeks, if not days? And so the first thing that we did is we shut down all elective and non-emergency care. We shifted all of our cases to telemedicine. We stopped doing things like endoscopy unless it was an emergency. All elective surgery shut down. So we were able to start moving people out of hospital, but we recognized that that wasn't even enough. Just recently at the PLC, we've just built a field hospital that can add close to 100 acute care beds to Calgary. And that field hospital was built in 3 weeks, but you still needed those weeks, that time to build that hospital. In Calgary, we started with 66 ICU beds at the beginning of this pandemic. And we're now close to 500 ventilators and ICU beds in Calgary. So we are well above any of the projection models, including the worst case scenarios, if this goes out. And where things are right now, we're well below that 500 capacity. We've redeployed our physicians. So many of us are now actually working on COVID wards to take care of COVID patients, even if you're like an endocrinologist or rheumatologist or a gastroenterologist, but we're still also providing essential care like gastroenterology call like I'm on tonight, or a cardiology call, because people still get heart attacks. And so all of this requires time. And so I think the key thing is that as we're giving you a sense of what's going to happen in the future, just to recognize that still right now is the time to be that stationary doc, to stay at home, to give us more time for scientists to build vaccines and to create antiviral agents, and for our healthcare systems to prepare, just so we can kind of impress all of these modelers and show them what we actually did compared to what they predicted we would do.
Thanks, Gil. And Doug, maybe I'll give you the last word because we're running out of time. We're almost at 8:30. So you wanted to say something about herd immunity?
Well, I think we've been a little bit too gloom and doom. And maybe that's appropriate, but let's leave it on a positive note. I think I was going to build off what Kumanen said, and just like that, there's that profound effect for physical distancing at the higher levels. The first part's the hardest. Once we get, if we are taking that herd immunity approach, once you get some herd immunity, it really starts having a really large effect on reducing the potential coronavirus to spread more. So the first part's hardest, but once you start getting there, it really can dampen things down. As well, I think like we're buying ourselves time, and you already seen week on week all this incredible innovation coming out. And I'll tell you that our research institutes are humming. The healthcare workers are humming at developing and ways out of this. So, you know, in Ottawa, we have on the weekend approved point at source rapid testing company that's been working on this for a while. That's a great option now. You know, I love to see that in long-term care facilities where we can rapidly test. You know, and then Google and Apple and Coumadin's work. You know, Coumadin's been working on the passport as well, and how to do contact tracing. So I think what we're doing is we're buying ourselves time, and that time's going to pay off. I really feel that we're going to be able to, you know, have a larger, more and more options on the table that we can look at to see if what's our exit strategy for this.
Oh, that's great. Thank you. Yeah, and I think I think one of the good news messages that we're sending is that Canada has done an amazing job. We really have done, you know, world class. We're in the better set of countries, at least in Europe, that you know have done an amazing job at the physical distancing and at flattening the curve. Our health system at the moment is not overwhelmed. It's not quite time to just relax everything, but we're not overwhelmed. We're coping. The doctors, the nurses, the healthcare staff, the paramedics are all doing an amazing job. And we always end off by thanking the healthcare workers that are on the front lines and doing the work and going to hospitals so that you can stay home. So you stay home, please, because we are going into the hospitals. We don't want you there as well. But we also want to thank all the other essential workers, right? All the grocery store staff, all the pharmacy staff, the pharmacists and the technicians and the staff working there, and everybody who has to go to work so that we are keeping some degree of our economy running and we're able to get the essentials. We're able to get food, we're able to get drugs, we're able to get all the stuff that we need. And so thank you all.